I've actually been a speaker for Primary Care Network for a number of years, and they're known for putting on very high-quality, interactive, engaging programs for primary care. But this is going to be different because it's going to be much more focused on those difficult, challenging, complicated patients in our practice. And these are going to be located in destination areas. I know one of the locations is Hilton Head, for example. Another one is Captiva Island, Florida. And this is designed for providers that really want to go beneath the surface and try to get very practical information on how to treat these challenging patients in our practice. And it's not pharmaceutically sponsored. And what's really unique about this is there's only going to be 3 of us that are speakers or presenters. And we really want to encourage participants to come with case studies, come with questions. We'll be breaking into workshops. And I know for me, when I look at my schedule, there's a small percentage of my patients that creates most of the problems for myself and my staff. And a typical patient comes to mind that perhaps comes in, and yes, they have migraines, but they have fibromyalgia, they have depression, they may have issues going on in their home, and sometimes they come in and they have that depressed look, and you feel like nothing you can do helps them. And it's those kind of patients that really, I don't know the exact statistics, but I would say probably for many of us, probably 3 to 5% of our practice, brings us 95% of our problems. And so I think that's what we want to do in this, is really focus on those difficult, challenging, complicated patients, and do so in a very interactive format.
So you do have answers so that people like that can be helped?
Oh, I think so. I think that those of us that are presenters, the 3 of us, we have a lot of experience with this type of patient. And yes, we may not have a miracle cure, but I think that we can work with the participants and engage together and say, what's the best way to approach these patients? Particularly when you've got all these different conditions and you've got a lot of psychological issues going on along with the more straightforward medical issues. And some of the topics we're going to cover would be migraine headaches, diabetes, drug addiction, patients that are narcotic seeking, how do you deal with them? And again, many of these patients having comorbid conditions, so they don't just come in with one condition. And how do we work with these kind of patients in an effective way, particularly in a busy primary care setting?